Good morning, ladies and gentlemen. This is Dereck Blair, and president and founder of Caprock Financial Group, and this is Caprock Wealth and Wellness. And if you'd like to reach out to us, it's 806-749-7870. And I am super excited about today. We have, number one, we have a special guest with us today. And number two is it's another Texas Tech football Saturday. We're playing Oregon State, going to get another win today. It's going to be beautiful weather. And so we're just super excited about that. So thank y'all for taking the time to join us. So today I'm super excited about our guest, kind of a local celebrity, great doctor here in town, has got a good reputation, and we're really excited to him joining us. This is Dr. Jon Skelton of Live Life Well. Good morning, Jon.
Hey, good morning, Dereck.
I appreciate you taking the time to join us.
Yeah, thanks for having me.
So one of the things that attracted me to Dr. Skelton in his practice was taking a more holistic approach. And that's important to me because as a financial advisor, we look at that financially when we build retirement plans. Let's look at the full holistic plan, not just we're going to put you there and this is what's going to work for you. Because you know and I know everybody's different. Couples are different, individuals are different. And so it's fun to build a specific plan for each individual. And doing the background into your practice, that's what we're seeing.
Yeah. Absolutely.
So kind of give us a background where you got started and what brought you to this place where you are right now with your practice.
Well, sure. So I started in emergency medicine. I went to undergrad med school here at Tech, then moved back to Central Texas for a few years to do residency in emergency medicine. And my wife and I, we were gone for about 6 months from Lubbock, and we were like, man, we really messed up. And so we started working then to figure out how we could get back here. And so came back in 2005, started working at Covenant in the ER there at Lakeside then, or Women's and Children's now, and then also the main ED there. And worked there for about 11 years, got up into the administration of the emergency department, and was just really realizing that, medicine, the way they ask you to practice it, doesn't really seem to be getting the results that we all went to medical school for our patients. And so that led me and a few other individuals to start Star ER. And so we started Star ER in 2016, and I still work there as an emergency physician. And then through the pandemic, I really then began this practice, this Live Life Well clinic practice. And what really spurred that was my experience in the emergency department through Covenant and then at Star, because what I was seeing is chronic disease over and over again, specifically diabetes, specifically patients coming in, having that sequelae of, chronic illness that is progressive, that isn't getting better, that patients didn't really seem to be getting all the information they could. I would sit down and discuss with them as much as I could in a busy emergency department, things that they might be able to do, things that they could try to really help improve their health. And they talked like I was, revealing something to them that they had never heard before. And that really kind of shocked me because this just seemed like common sense that everybody, would really know. But it was readily apparent that wasn't the case. And so that was a little bit of that impetus to start Star ER. And I am able to sit down and speak with patients a little bit more at length there than I was at Covenant. But really over time, I just realized that, they're still not getting what they need. And so that was really kind of the impetus to start the Live Life Well clinic so that, we can reverse all these chronic diseases that we were never meant to have, that are a function of diet and lifestyle and honestly how we approach our everyday.
At your clinic, Live Life Well, do you see it more of you're more taking a proactive approach to the lifestyle, or are you having to do some reactionary? Where do you see that fits in the best?
It's both. So it's always best to be proactive, right? And so I think where people get caught up is lack of vision. They just really don't have a true vision for every aspect of their life. Everybody says, well, yeah, I want to have kids. Well, yeah, I want to have grandkids. I want to have a house, or I want to retire. I want to have good health. But nobody really sits down and thinks about what that actually looks like. what does good health mean? What are you doing? Who's there? And so from a proactive approach, that's where I take it with my clients who don't have any known diagnoses as of yet. But I also take that approach for my clients that do. Because if you don't have a vision, your goals are effectively kind of meaningless. Just accomplishing a certain weight loss goal or doing a number of reps or pushing up a certain weight for guys in the gym, it's a little bit meaningless if that is all you're really looking at. So I really try and help clients create a vision for themselves, what they want their life to be, so that then they can have the will to implement the hard changes that we're going to be asking for.
That sounds it's funny you say that, because it sounds exactly like our business, where someone walks in and says, "Hey, I'm ready to retire. I've worked 40 years. Here's my 401k. What can I do?" Well, then I got to be reactionary. Okay, let's put a plan together. Yeah. Whereas you have people that want to be proactive and say, "Hey, I'm retiring in 20 years, 30 years. I'd like to make a plan. And there's so many things that health-wise you deal with, financial-wise I deal with, taxes, legislation, things that can affect people in the future. They don't realize it. Is the bulk of your business did COVID change your mindset with the way that was kind of dealt with COVID, the vaccines? And I'm not being political, please don't think that, but just overall, did it kind of change your mindset that, hey, there's a better option, there's some better things we can do for our friends and our families?
Well, yeah. So, being right there on the front lines of COVID, granted, it wasn't a, huge hospital emergency department, but, at the beginning, I mean, we were all scared like everybody else was. What does this mean? What are the short-term and long-term implications of it? If I bring it home, I have a child with special needs at home who, when she gets ill, would go into status epilepticus and frequently have to go to the hospital and potentially even be hospitalized for a day or so because of that. So there was a lot of fear, just like everybody else in my life. But my wife, I really credit her. Sarah was really kind of on the front lines, and I will say her eyes were open to it much more than mine were initially. And she really kind of was, in many ways, a lot of the impetus for kind of getting out of this traditional healthcare setting and really kind of starting this new way of looking at things. It's things that I had been looking at and exploring even prior to, but yeah, COVID just really ramped it up.
Yeah. Do you see that after COVID, do you have an impression that people are taking a more active lifestyle, that there are they are looking out for themselves a little bit more?
The great thing that's out there right now is people actually are feeling empowered. They actually are realizing that, hey, I don't just have to take all this stuff. I don't have to take all these medications. There's other things that I could do. I could live, maybe a little bit more simply, a little bit more, if you will, historically, so to speak, the way we used to. And if I do that, those techniques and those things are really resulting in quite a lot of benefit for people.
I definitely agree with that. I think, living in shallow water, when COVID happened, it was very interesting. And I've said this before, it was terrible when it happened, but it was interesting because the people that we saw walking outside, exercising outside, riding their golf carts outside, riding their bikes, it was incredible how many people you would see a night just walking, just being outside, exercising with their family. And it was really kind of as bad as it was very neat to see that happen.
That was actually one of the kind of neat aspects of COVID in a lot of ways, was the family togetherness that it created. You didn't have Johnny and Susie running to soccer and baseball and football and everything else all the time. And so we were actually kind of forced to slow down for the vast majority of us. And that forced slowing down really created a return to cooking at home, to really looking at kind of what you're doing, what you're watching together even. And then, really did promote some of those outdoor activities as a family unit and family movement together, if you will. And so yeah, I absolutely think that was a big benefit to COVID as far as that goes.
I agree 100%. So let's take a quick break. We got to pay for the airtime. So let's take this quick break. When we come back, I want to talk to you about some basic stuff with retirees as far as stepping into the grocery store, kind of where to get started and what to look for as we start to take care of ourselves in this next best chapter of our life. So we'll take a quick break on this. Okay, we're back. And again, this is Caprock Wealth and Wellness, Dereck Blair with Caprock Financial Group. And we have Dr. Jon Skelton joining us this morning from Live Life Well. And we've been talking about kind of overall health and taking care of yourself as we start to age. Now, with your practice, do you see yourself more in the baby boomer generation, or are we starting to see some younger people that are being proactive?
Yeah, so both. So I see primarily my clients fall into that 30s to 50s age group, but I have clients as young as 12. I have clients as old as 80. So it just really kind of depends, what it is that they're looking for. Kind of like I mentioned, with eyes being open to COVID, I think a lot of people through all age ranges kind of, become aware that, hey, there's a different way to do things with regard to my health that I haven't really thought of before. And that gamut, has reached the very young to very old.
Mm-hmm. Yep. One of the things when clients come to see us and we have our first meeting with them, we have a process called the inspiration conversation. And that first meeting is a conversation. It is just kind of get to know them. We ask a lot of questions. They get to know us. And we want to learn about them because, like I said before, everybody's different. When someone comes to your office, whether they're hurting, whether they're in shape, kind of what is your process to find out how you can help somebody? Where do you start?
Yeah, so first of all, I want to make sure that we're equally yoked. And so what I mean by that, the ways that I want to approach things, are they of a similar mindset? They don't have to be exact by any means, but I do that through a process I call a discovery call. So what that is a 20-minute phone call where I just find out a little bit about you. What was your impetus to even scheduling this for today? Maybe what things that you've already been diagnosed with or suspect that you have. And so I'll get into that to really determine, am I a potential resource for you or not? Because, I'm not going to be right for everybody. Mm-hmm. And the last thing I want you to do is waste your time or, money and resource investing in something that isn't really right for you. And so, or me, for that fact. And so we'll do that discovery call to tease a little bit of that out. And then I'm also able to explain a little bit about how I work and what I do. But really kind of as clients decide to take that next step forward, what we do is we have a pretty extensive intake form. That intake form's about 45 to 50 pages in length if you were to complete it. The vast majority of that information is symptom-based questions. And the reason we do that is because even though you may have a diagnosis, you may have symptoms that are really pointing to a different root cause. And so when we test, we want to be very, very thorough when we're testing any organ system. And then we also want to be very, very specific with the ranges that we're using. And so I use that form to come up with that plan for testing. And then in the hour together, even though you filled out all this information, I'm going to have more questions, more clarification so that I can really understand you, your goals, what you're looking at as success, because your definition of success turns into my definition of success for you.
Mm-hmm. That's awesome. You're getting to know a person on an individual level, and you're not just diagnosing it, hey, go take some medicine, run out of the pharmacy. You're trying to get to the root cause of how we're going to fix this.
Yeah, absolutely. Because to me, treatment is first diet and lifestyle, second supplements, third medications. And, most people need some form of at least two of those to some degrees. But, some people need all three. Just really depends on the individual. So I'm not going to mandate you do X, Y, or Z. The way I look at this, I'm a coach, you're a player. I make suggestions, you implement. And so probably much the same way I would suspect that you operate in the financial community.
Exactly. No, we're right on the same page with this. When you talk about lifestyle, is it, and I know it, I think we're on the same page, it's going to be pretty much equal parts exercise, and diet?
Well, so movement is an absolute,
Okay.
but it's much less movement and much more so diet and lifestyle, actually.
Okay. Okay.
So you can't exercise your way out of a bad diet. You can get a good diet and lose weight without a ton of exercise. But it really, is a marrying of both. You do need both, but it is much more diet and how you approach your day than it is exercise in and of itself. And I think that's where we kind of got lost in the 80s and 90s, where I kind of grew up, is, no pain, no gain. You got to push through it. It's got to hurt, all these things. And what we really found out is that the more Cheetos you eat and the more Twinkies, doesn't matter how much you work out, they're still going to cause problems, even if they're not adding weight.
Yeah. The diet thing is so hard though, especially when you have somebody like myself. Sometimes I'm on the road and man, it's so easy just to grab an Allsup's burrito because it's there and it's pretty dang good. And that's the tough part, is being able to kind of meal prep and take care of myself. But I will go back to saying, when I exercise correctly, when I'm doing the right things, I want to eat better. I don't want to put those bad things in my body. But then it's a catch-22 that if I don't work out, well, okay, I can go ahead and cheat on my meal. Then I fall down that rabbit hole and I got to come back out of it.
Yeah. Well, and that's one of the big things, is I think the way that God wired us is we have all these neurotransmitters that are going on in our brain, no matter what it is that we do, right? So you got dopamine, you got norepinephrine, you got serotonin, you got oxytocin, among others. And so we live in a dopamine addicted society. That Allsup's burrito, those Twinkies, those Cheetos, they are dopamine addicts, just like your phone or anything else, whether it be alcohol or drugs. It's all dopamine driven. And so once you kind of realize that, you can start to kind of say, okay, this is more of an addiction than what I actually realize. And when you have that vision, then you can sometimes say no more often to those things and do the hard work that it really takes to get you where you want to go, to get to that vision that you have for yourself.
Yeah, no, I agree. And I've got to ask you this question, and I'm trying not to put you on the spot, but I really want to ask you, what are your thoughts on these quick diets where you're taking these shots, it's suppressing your appetite? What is your overall feeling, your overall impression of what these are doing to our bodies when people are taking these?
Well, quite honestly, we don't know. We don't know long term what it is or isn't going to do. We do know that it is altering the gut biome that's present in our gut that we get as we come through the birth canal and through our mother's milk and the antibiotics that we've been subjected to or not subjected to, the things that we eat. We do know that it is altering it. It might be for good. We don't really know. What I can tell you from my experience in the ER, it causes a heck of a lot of abdominal pain and misery for a lot of people. And we're not talking, the pancreatitis and the two paragraphs that they read at the end of every Manjaro commercial, of side effects. What we're really talking about is abdominal pain, nausea, vomiting, constipation, and or diarrhea. And I see this every single week in the ER with patients coming in. But effectively, what these medications are doing is they're inducing a fasting state. We've known that fasting has been of benefit for people since biblical times. I mean, it's right there, starting all the way back in the Old Testament through all the way through the New Testament, and talking about that. And virtually every religion that's out there has some historic fasting, principles. And so we know fasting really, really works, and that's effectively what it's doing. The unfortunate thing is that when people get on these medications, there isn't really a plan to get off. And you can't stay in a fasted state for months and months on end. your body craves variability. Your body will then start to have muscle loss over time. And that, as we age, especially when you get to retirement age, can be a big deal. And so my big concern with these medications is we don't know what the long-term effects are going to be. We do know that muscle loss is occurring. We do know that muscle mass is very important as we age to help things with like bone density and hormone regulation and all these other things that we need, especially as we age, because normally our hormone levels are going down as we age. And if we're taking away even more muscle mass, that can create a bigger issue.
Mm-hmm. Speaking of that, that's a good point with the hormones. You're seeing a lot of movement on the hormone replacement, on these testosterone pellets, the testosterone shots. Kind of where do you stand with that? Do you believe in that? Is that something people need to look into?
That is something I do with some of my clients. I will tell you, my views on that are a little bit different than a lot of physicians. When I look at doing hormone replacement, I look at doing creams or patches, something that you can easily remove. And again, this goes back to my emergency medicine experience, as well as just thinking about this practically. Anything you put in your body is in there.
Mm-hmm.
Once it's in there, not a lot we can do about it. We can sometimes give you medications to counteract effects. So think of like an allergy. You went out to eat, you know you're allergic to peanuts, somehow you got a peanut. And so we'll give you medication to suppress that natural immune response for at least 3 to 5 days, because that's how long it's going to stick around in your body. Well, if you're doing a shot, that's in there a week. If you're doing a pellet, that's in there 3 to 5 months, depending. If you've gone up too much on your dose, you can have a lot of side effects that can be negative, from anxiety, increased heart rate, increased blood counts, potential for clotting, and lots of issues. So my approach is if we get to the point where we are starting some hormones for someone, we're going to do it topically, because guess what? You can wipe it off. We can go down on the dose, go up on the dose. We can, again, kind of as you mentioned, tailor it more to you as opposed to just saying, this looks about right. Boom, sticking it in your body, and then it's there for a week or months.
Okay, I can appreciate that because you're being conservative. You're watching out for it, and we're not injecting anything that we can't really control in a few days.
Right.
Okay, lovely. Let's talk about if somebody's going to the grocery store, everyday person, grocery store. Where do you want them to go? Where's the best place to get started, and where's the places we need to avoid? Because I've always heard if you'll stay on the outside, you're going to do pretty good.
Yeah.
It's those inner side parts with the Pop-Tarts and the Cheetos that's the good stuff. So kind of an idea of where do we need to get started and what's going to be the best way to prep for this kind of thing?
Yeah, so I have a little saying that I've kind of come up with. It's eat the garden, then the pasture and the sea, minimize the fields of grain. And so what that means is practically what that means is you're going to eat real food. Well, what's real food? That means it came out of the ground. It looks like it came out of the ground, like it originally was intended, or came off a tree. Or you can tell that's beef, that's chicken, that's pork, that's fish. You can look at it and know what it is. A Funyun, you have no idea what a Funyun is.
But they're so good.
Oh yeah, I mean, not denying the taste, but yeah. So you need to eat real food. So what that means is that you're shopping in the produce section first, then you're going to the butcher aisle. Then maybe you're going, depending on the individual, you may be going to the dairy section, okay? And really that's about it. That's essentially where you're going. Now, you can do frozen vegetables as well, as long as they don't have a lot of added ingredients into it. But that's what we're talking about. We're talking about real food, not something that's fake. And the reason I say, kind of minimize the fields of grain is because if you go to the grocery store and you're, trying to buy food off the grocery store shelves, that's where it gets dicey because it says bread, it's not really bread. it has been enriched, which means basically they've stripped it down to nothing, and then they've added a bunch of other stuff back in to make it so that you won't get a chronic disease from a deficiency.
Mm-hmm. I was watching Joe Rogan the other day, and they were talking about some seasoned salt that he uses every morning on his eggs. And he says, if you look at those ingredients, it's full of sugar. That's the first ingredient on there. It's not salt, it's sugar.
Yep.
And that's supposed to, and that's what he was worried about. And that's the kind of things we're not aware of what they're putting in these to make them last and taste good.
Well, and that's what's funny, because literally I was at Walmart 2 days ago, and I was buying some frozen vegetables because, like you kind of talk about, when you're on the road trying to do things, sometimes it's difficult. Well, one of my go-tos is getting a steamer bag, putting it as often as I can in a glass bowl, heating that up in a microwave, and just hitting those green veggies, because I know those are going to be good for me. But I usually shop at United for my vegetables, and so Walmart had a little bit different variety there. But I looked on the back of this package, and it was a Asian medley mix. I don't remember the brand. But so I was having to look through on the back of the package, which I know this personally, but a lot of people don't. It was filled with artificial butter, soybean oil, and sugar on the vegetable package. And so you think, I'm buying vegetables, but really you're buying a bunch of junk and you don't even realize it, but it's dressed up as vegetables.
Yeah.
So
yeah, you just got to, it's hard to double check. Well, Dr. Skelton, I really appreciate your time. Ladies and gentlemen, again, the reason that we do this here at Caprock Wealth and Wellness is it's just what we see over time is we just want people to be healthy. Whether you're our clients, you're not our clients, you're just an everyday person, we want you to be healthy. We want you to enjoy retirement, enjoy your life, because if you have grandkids, if you're going on vacation, it's just so important that you're enjoying this, because I've seen it for myself. When you stop, when you slow down, it's when you start to age. And this next chapter should be the best chapter of your life. And so we always encourage that. It's very important for us. So Dr. Skelton, where do we find you? How do we get a hold of you?
Yeah, so the easiest way is you can go to livelifewellclinic.com, and you can get on the website there and schedule a discovery call. Our practice is located at 8705 Milwaukee, and so we're there as well. And so you could also give us a call. We kind of have a funny phone number. It's 833-806-9355. And yes, the 806 is in the middle. But we, operate on an appointment-only basis, and hours do vary. So it's usually best to call or to just sign up for that discovery call, which you can book yourself online.
Awesome. Well, thank you so much for joining us today. I greatly appreciate it. And by the way, Dr. Skelton is an ex-Red Raider. So he has a special place in the Red Raiders in his heart. So I'm sure he's going to be rooting for them today.
Oh, yeah. Wreck them. We've got to beat the Beavers. So.
All right, ladies and gentlemen, thank you all so much. I hope you have a wonderful day. Go Tech. And we'll be talking to y'all next week. Thank you.